Hey everybody, Dr. Dave Marquis here, and I wanted to talk to you about a patient came in recently who was expressing that they just didn't feel like they were balanced. And the first question was, have you ever had vertigo before? Now, vertigo is where you have a sense that either the world is spinning around you or you are spinning. Either way, you're unstable. And she says, no, that's not it. That's not it at all. It's just I feel like I'm a little bit off. And I asked, could you please explain that a little bit more? And the comment was, well, it would appear that my hearing has shifted such that I'm able to hear on one side of the body but not on the other. And that happens, certainly. People can lose hearing in one ear. And so we did a simple hearing test with a tuning fork, and sure enough, she had about a 80% reduction in hearing on one side versus the other. Well, it also turns out that the side of deficit, the side where the hearing was lost on, correlated with the same side where this individual had had Bell's palsy previously. And when an individual has Bell's palsy, it's actually affecting one of your cranial nerves that comes right off of your brainstem. And so I started to think, okay, well, this is really interesting. This is kind of atypical from many cases of tinnitus in that most of the time people are hearing a ringing. And so I said, I don't think this is tinnitus at all, and it's certainly not vertigo, but you do have hearing loss. And so we did direct hearing, and then we did what's called bone conduction, where you just put the tuning fork on the skull and it vibrates the bone. And that also was diminished. So she had an equal amount of loss, whether it was bone conduction or direct hearing outside of the ear with the tuning fork. So that told me that, okay, there's probably something going on neurologically in the auditory cortex. Now that's part of your temporal lobe. It's a region of the brain that has a nuclei that regulates the sound vibration that is being received by the membrane inside the ear and all those nerve endings, and it talks to that. And if you literally uncoil that little nuclei, it has what's called a tonotopic map on it. And this is where it gets kind of cool, because I like to think of like a keyboard in there. And one of the ways that we work with individuals that are suffering from any form of tinnitus is to optimize blood flow, because we see that that is part of their condition in many cases. But in this particular case, I didn't think it was going to be directly associated in the fashion that most cases that we had worked with were, because it was unilateral. It was only happening on one side of the body. It wasn't happening on both. And it was also the same side of the body that she'd had a prior insult neurologically with the Bell's palsy. So thinking of that, we have some different tools here that we use, and one was a low-level laser. And the neat thing about the laser is you can adjust frequencies to kind of match brain frequency activity. And so we adjusted the frequency to a specific range that allowed us to safely apply light to that region. And the important thing about low-level lasers in brain is that there's no heat involved. You don't want to apply a lot of heat to the brain. And so low-level lasers are extremely safe for this. And then the other thing that we used is a pulsed electromagnetic field in that region. And what that does, the combination of the two actually focally not only increases blood flow to the brain, but also kind of coaches it in an electrical fashion as to what it's supposed to be doing. And lo and behold, after about 20 minutes, this individual had about 70% of their hearing restored in real time. I said, okay, this is something that we can tap into. Well, step back one portion, because I left an important piece out, and that was something that we saw going on with her eyes. Because what we wanted to leave this patient with was some tools that she could do at home so that she can continue to stimulate these neural pathways to help to integrate what she was losing neurologically. And so we had her do what's called a pursuit, where your eye moves from one side to the other, and I saw that it would kind of hiccup as it went along. It just was not a smooth pursuit. And then a saccade is when the eye comes back, and the same thing. She had a little glitch as it went along to catch the other side. And then when we had her do a convergence where we bring the finger up to the nose, when we got within about 6 inches, this patient had to step back, almost fell backwards because they became unstable. This is where the individual was experiencing their instability. Now, recognize that each of those movements that I just kind of moved with my finger are predicated on how efficiently certain lobes of the brain are working. Well, a certain region of that, the occipital lobe, which has the cerebellum is back there and your visual cortex is back there. Now, if the eyes are trying to send some information back there and it's not transmitting in a 1-to-1 ratio, the brain tells the eyes to go back and take another picture, please, and superimpose it so I can kind of make a composite of what I'm looking at. Well, when you're converging your eyes and they start to cross over, and it's more information than that region can handle, that's called exceeding your metabolic capacity. And all of us have experienced that at some time in our life. It's where we just feel pooped out. We've hit our wall. We're done. We're toast. I got to check out. I got to rest. You're not able to continue functioning. And for an individual who is standing up, that may be the moment where they go down because they're not able to tap into a region that allows them to engage their righting reflex. And the best place to be is low so that you're not going to stumble. So the body brings you down. Well, that was really an interesting moment because I could see in real time that, okay, we've got two regions of the brain that are neighbors that aren't working well. One provides visual input and the other one provides auditory input. The two together provide your balance. So this is where her instability came from. So here's the cool part. While she was doing this laser work and this pulsed electromagnetic field work on that part of the brain, I was actually working with her eyes and giving her a little bit of a challenge, trying not to fatigue her, but trying to get to a point where that part of the brain would at least be tasked. Because everybody needs a job, and our brain needs a job. When it doesn't work, and this is an important one for all human beings, when we stop learning new stuff, we start losing our old stuff. So you always have to be working it. And one of the saddest things that I see when an individual comes to me with a neurological concern is that they're loaded down with pharmacological substances that are basically deadening those processes and mitigating symptoms so that they feel better, but it's actually playing kick the can. It's worsening the problem in many ways because an individual isn't actually entraining the regions of the brain that need that help. And oftentimes, they're completely ignoring the inflammatory process that initiated the whole situation to begin with. So both of those things always need to be taken care of. So that was my little sideline, sorry. So we do a little bit of visual stim. She's getting the laser, she's getting the PEMF. We stop that, then we retest. Hearing is there. I have her stand up, and we converge the eyes, no dizziness. She's actually able to bring her eyes together now and not wipe out. Well, that lasted for her for about a week. Not bad. One treatment lasted about a week. So then she came back, and I could see that, okay, she's not where she started. She's definitely a little bit better, but that area has fatigue and it needs a little bit more work. So it would be a sheer miracle if it was just a one-off. Rarely in my career have I ever seen that. But it is pretty cool when you start to see a little bit of longevity in what the brain can achieve in a short period of time. I'm comfortable going out on a limb saying that with a little bit more effort, probably about 6 more times of this individual working that part of the brain repeatedly and not frying it, not taking it to a point of total fatigue, she'll probably have that, the main issue of the imbalance and the partial hearing deficit, that should be under control. So I share this with you because a lot of people are suffering from weird stuff. And whether it be vertigo, whether it be tinnitus, whether it be positional awareness, eye-hand coordination, there's so many things that we kind of just shove under the carpet and say, well, I'm just getting old. Don't do that. Do not do that. Realize that if you're above ground, you have room for improvement. And this brain up here just needs the right evaluation and the proper stimuli. So I hope that was an interesting case to share. I hope that might spark some interest in individuals to take action and get a second opinion if you've been told that you're nuts or you just need some meds to quiet something down. Realize that if you're not actively engaged in working the body parts that seem to be failing you, you're probably leaving some valuable tools on the table. Have a great day.